So what I want to talk to you about this morning regarding healthcare in this country is simple, but it's difficult, and that is prevention and wellness. You know, I'm very fortunate to have a president as well as Secretary Sebelius and an entire administration who is really dedicated to prevention. But before I talk about prevention, I want to tell you why it's important to me. When I was an intern, I attended the Medical Association of Georgia's annual meeting. And one of the intense issues that was being debated was that sexually transmitted diseases needed to be taught in medical school. Well, I stood up in a room with maybe 20, 25 people, and I told them I'd never seen certain diseases except in a textbook, and I thought there was a need. The reference committee passed the resolution, and they forwarded it to the AMA. The Georgia delegation sent me to the AMA to speak to the same issue. And at the AMA, the resolution passed. And within 6 months, every medical school in this country was encouraged to include sexually transmitted diseases as part of their core curriculum. I learned that one person can make a difference, whether it's in medical policy or in medical practice. And I learned that I could make a difference in medical practice when a National Health Service Corps sent me to Biola Battery. It's a pretty place, but it's a poor place. I found a community of working poor, too poor to afford medical care, but too rich to qualify for Medicaid. I liked the people, I liked the community, and I wanted to practice medicine there. But I quickly learned that practicing medicine wasn't just sewing up the shark bites. I had to deal with the land sharks, the regulators, the reviewers, the red tape dispensers, and all that paperwork that we have to go through. But I also learned that my patients had problems that my prescription pad alone couldn't take care of, particularly after Katrina, like housing and water and things that they needed. In fact, I would like to tell you about one patient, Ms. Smith. That's her HIPAA name, by the way. Ms. Smith is 30-something-year-old African-American lady, about that high. She's overweight, and she works in the school system in the janitorial department. And I have my patients call me if they have a problem. So I got a call from her on a Saturday. She called me and she says, "Dr. Benjamin, my back is really, really hurting. I went to that specialist you sent me to. He told me I have a slipped disc and that I need to lose weight. I'm trying, I really am. But this ibuprofen is just not strong enough. Can you call me something in stronger?" I said, "Sure, I can call you in something stronger, but you got to come and see me on Monday or Tuesday." She said, "I will, I promise." And sure enough, on Tuesday, I walked in the exam room, and there she was, leaning over the exam table. She was leaning because she was in so much pain she couldn't sit down. And I said, "Miss Smith, did the medicine I called you in, did it help at all?" She says, "Well, Dr. Benjamin, I didn't get it." I said, "What do you mean you didn't get it?" She says, "I couldn't afford it." I said, "But you work for the school system. You have insurance. What do you mean you couldn't get it?" She says, "I know, but I just didn't have the copay. But I get paid on Friday, and I promise you I'll get it." So I stepped out of the room, and I went to my nurse, Nell, and had her go across the street to Jim's and get her prescription for her. So I went back in the room, and I gave her her medicine. I said, "Miss Smith, you're obviously in a lot of pain, and you need your medicine." And I gave it to her. And at that moment, her eyes welled up with tears. And she says, "Oh, Dr. Benjamin, I'm so embarrassed. I didn't want you to have to do that." And at that moment, I realized I had taken her dignity from her. I also realized that cultural competency has nothing to do with the color of your skin. It has to do with allowing people to keep their dignity. And so I had to figure out how to get out of that one, because obviously I'd put my foot in it. So I told her about the fact that we had people who, particularly after the hurricane, had sent us small amounts of money. We had a small pot of money to help people just like her, to help them with their medicines. And if she wanted to, she could pay it back on Friday when she got paid, but she didn't have to. And she was okay with that. But as I was leaving the room. She says, "Oh, by the way." And I said, "Yes." And she says, "Well, can I get a work excuse?" I said, "Sure, you can get a work excuse. Today is Tuesday. You want to go back to work on Thursday or Friday?" She says, "Oh, no. We've got to strip those floors tonight." Here is a woman who is in so much pain that she can't even sit down, but she's willing to strip the wax off the floors so our kids can go to school in a clean environment.